Hi, my name is Julie Dinh, and for the Community Mental Health Agency report, I decided to do it on the Victim Intervention Program by Valley Community Counseling Services. What is the Victim Intervention Program? The Victim Intervention Program, VIP, also known as VIP, was created by Valley Community Counseling Services. Valley Community Counseling Services is a nonprofit organization located in the Central Valley of California. The Victim Intervention Program serves children and adults who are survivors of sexual abuse, physical abuse, and other crimes of violence. They provide counseling to families of these survivors and also parent child interaction therapy for children aged 2 to 7 and their caretakers. The target population of this program is a range of children, teens, and adults who sign up for the VIP program. The population will come from different backgrounds that have experienced sexual abuse, physical abuse, and other crimes of violence. What are the different treatment methods used in the program? They use individual therapy, family therapy, and play therapy for children. How is the agency organized? Funding for this program is under state funding, which is the Victim Compensation Board. Children can be funded by VCB as well as a chat grant, which is for child abuse treatment. Referrals can come from multiple sources such as CPS from multiple counties, victim witness offices, schools, referrals from therapists from different agencies, law enforcement, and child abuse prevention councils. Therapists speak predominantly English and Spanish as well. The services offered are counseling for survivors. They provide direct therapeutic services for both children and adults. And then this can include individual counseling, group therapy, or other techniques tailored to the unique needs of each survivor. Another service offered is counseling for families. They offer therapy for families of these survivors. I think that this is important because I think when it's not only the survivor that feels the weight of the effects of the abuse, but family members and those that are in close relationships to them can help improve their communication, understanding, and support for the survivor. And then this will create a healthier environment for healing as well. The third service offered is parent child interaction, specifically for children ages 2 to 7. This will help with the relationship between parent and child and addressing the behavior issues that might be caused by the aftermath of the abuse or the trauma. And the therapy also helps parents develop positive parenting techniques and helps with children and their regulating emotions. The treatment approach for VIP is primarily trauma informed care. They are serving, survivors of sexual abuse, physical abuse, and violent crimes. And this means that their services are structured to recognize the impact of trauma on the behavior and mental health, and making sure that the interventions are making these clients feel safe. The second treatment approach, as I mentioned before, is parent child interaction therapy. And then lastly is a holistic family centered care by offering services for both survivors and their families. They emphasize family systems approach to healing, and it acknowledges that trauma just doesn't affect the victim, but it also affects their families. And it can encourage them all kind of work together to really create an environment to foster the healing for the victims. Three additional community resources that I searched are all pretty close to the San Joaquin Valley, if not in it. The first one is Operational Care. It is a nonprofit in Amador Valley that provides safe shelter for women and children survivors of intimate partner violence and sexual assault. And it provides emergency shelter to additional individuals in the area, in hotels, and then it can also help with battered women and their children and creating a safe house for them as well. The second community resource is Lodi House. Lodi House is a nonprofit in the San Joaquin Valley that offers a structured home environment that focuses on building healthy relationships, providing parental tools, goal setting, accountability, and connection to community resources. The last one is Mountain Crisis Services. It serves the Mariposa County and provides a 24-hour hotline to help and uh, inform victims of domestic violence and sexual assault. It helps them connect with emergency shelters and other services as well. Discuss some barriers that clients from your population of interest might face when searching for resources and referrals on their own. What might prevent them from getting the help that they need? A few of those barriers I'll talk about, and the first one I'll start off with is fear and shame. There's often a stigma, a fear of disclosing, the abuse, the embarrassment behind it, the fear of retaliation or repercussions, the idea of having it get out, and then having the person that assault them be mad about that and possibly retaliate is a huge threat. The second one is a lack of awareness or knowledge, so unawareness of available resources, confusion about the process, not knowing where to look, being confused on where to find these community resources. The third one is lack of trust in professionals or institutions, distrust in authority figures, specifically survivors of abuse who have been abused by family members or a spouse or a partner. They may have just really a deep-rooted distrust and have an ability to, not be able to trust others as much as they used to. And then previous negative experiences. If a survivor has previously sought help and encountered insensitive or dismissive responses, it can kind of deter them from reaching out for help as well. Reflect on your personal impression of the agency and how accessible it is to marginalized populations, how well it addresses issues of diversity, inclusivity, and how well it integrates or has the opportunity to include systemic and relational approach to mental health. The first one is accessibility to marginalized populations. For survivors from diverse cultural backgrounds, having access to services that are both culturally and linguistically appropriate is essential. For this program, they mentioned that there are Spanish-speaking therapists. I think that it'll cover a wide population here in San Joaquin County, but I also think that it's important to have other therapists from other cultural backgrounds, so that way the program can be more accessible to not only Spanish and English-speaking clients. The program's reliance on state funding is promising as well. It suggests that services are designed to be low or no cost to survivors, which makes it extremely accessible, especially if there's already a financial burden on these victims. The second one is addressing diversity and inclusivity. I think training for a therapist is important, just the regular cultural competency training, and I think that they also need to be equipped to understand and address the unique cultural, racial, and socioeconomic experiences of these marginalized survivors. Another one is gender and sexuality inclusivity. I think that the program specifically serves survivors of sexual abuse, but there should be a strong focus on ensuring that LGBTQ plus survivors feel welcome and understood as well. The third one is integrating a systemic relational approach. I think they do a great job with family-centered approach. It recognizes the importance of relational healing. Another one is the trauma-informed care. I think it's important to ensure that survivors are met with empathy, respect, and understanding, and it considers not just the survivor symptoms, but also the impact of societal systems such as healthcare, education, and the criminal justice system, and how it has contributed to the trauma and has made it more difficult to seek help. Overall, Valley Community Counseling Services and the VIP program seem to offer valuable trauma-informed approach that addresses complex needs of survivors of abuse. However, there is room for growth in making the program more inclusive and accessible, particularly for marginalized groups. That concludes my presentation. Thank you so much for listening.